back to another episode of the Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. I am very pleased to announce that I have the very talented Debbie Bleasdale with me today. So Debbie is a paramedical tattooist.
Yeah.
And you've been doing this for a while now, Deb.
Well, it's coming up 4 years now.
Yeah, right.
Yeah, absolutely.
Wow.
So it's been an amazing journey, not just for me, but for my ladies who come and see me as well. So it's sort of coming towards the end of their journey in wellness and recovery. So it's just an honour to be part of that and be able to contribute to that. It's just a lovely thing to do.
It is a very special place, isn't it, to work when you work with people who have gone through such a traumatic experience, to be able to give a really positive outcome to someone who has come through such a terrible time in some cases. So,
sure.
So what we would like to do today, guys, is walk you through nipple tattooing, which is now a very big part of breast reconstruction. There's obviously a lot more women going through to breast reconstruction after breast cancer, far more than there used to be. And I'm assuming you'd agree, Deb, that the techniques available with breast reconstruction have come a very long way.
They've come an awful long way. It's just been amazing. I'm noticing that from when I first started doing this to the amount and the volume of ladies starting to walk through now is multiplying all the time. So for that, it just shows you that it's becoming more of a normalised kind of procedure. The word tattoo in itself is always a little bit off-putting for a lot of people, but it's actually cosmetic tattooing, which is not a body tattoo, and in the way that it's a permanent tattoo. It's all semi-permanent, and it will fade out over time to some degree, and in that way it's nice to then refresh the colours. People's body shapes change even after reconstruction. The shape still changes. So if you were to get a fixed body tattoo, which is permanent, you're then stuck with something that just might need adjusting in the future once the breast changes again. Because after reconstruction, there is a period of time when the shape settles. So it's always good to have that little bit of move way to just tweak things a bit more. And as we get older, our body changes as well. The skin tone changes. And, you know, at 18, you might want bright pink nipples, but at 60...
that may be different.
It may be different. You don't want something that's just animated and looks more cartoony. So it's nice to do something that's going to have more natural effect.
I think the other thing that really fascinates me as well is this idea around the fact that breast reconstruction is becoming so much more normalised, and I think certainly a lot of my patients have expressed that sometimes they get judged for wanting a breast reconstruction after they've had breast cancer. So the normalisation of nipple tattooing and breast reconstruction, it's nice that this is becoming a norm for a lot of survivors.
Absolutely. And I think also, going back 10 years ago, 20 years ago, people who had, for instance, breast implants, it was always seemed to be, what on earth are you doing to yourselves? And there was always that little bit of taboo of, they're fake, for this, that and the other. But now to be able to have something that looks so natural, and to give back something, a body part that looks natural once you've lost it,
and
is
of course,
amazing.
Nothing against women who want to go flat and fabulous either, you know?
Absolutely, but it's nice to have that choice.
It is, isn't it? It's really each to their own, and I think that the fact that breast reconstruction techniques are getting so much more advanced, it's being normalised. There's people like yourself around whose main gig is to tattoo the nipples back on. It's amazing. But
even fat and fabulous, you still need that visual impact of having an areola and nipple. Fat and fabulous is wonderful too, but it's nice just to have that focal point. And you'll find that just by having the skin repigmented again, it detracts from any scar work.
That's a good point,
scarring that they may have, which is always been the focus. Once the focus is shifted from any scars, which there are always going to be scars, it's nice to have the focal point back on where they should be.
And that's a really good point too, isn't it? Because everyone, I think, has a different take on scar tissue. You know, some people are very comfortable with their scars and they like almost not show them off as such, but they it's a reminder to them in more of a positive way of what they came through. But then scars can be quite traumatic for other people, so the fact that a tattoo can take the focus off that traumatic trigger
for instance, I had one lady and she'd had beautiful reconstruction work done. The surgeon had obviously spent a lot of time in planning the future and how this was going to look in regards to shape, size, placement and scarring. But the scars did run laterally across, and the first thing she said to me when she came is, can you please just do something with the scars? Can you camouflage the scars? Yes, I can. But once I'd done the tattooing of the nipple and areola, she never mentioned the scars again.
Oh, wow.
Because
Isn't that amazing?
the focus had been taken away.
Yeah.
So,
absolutely,
it's just amazing just what can be done just by that visual impact.
So how did you get into this in the first place, Deb?
Well, I got into it being a registered nurse for many years and not particularly wanting to see my future just in that field of mental health, even though it's been an absolute asset to every part of my life. There's always been this creative demon trying to get out. So I started drawing and painting and realised, I really need to move this on. Drawing and painting in itself is not going to make a living.
Sure.
Unless you sort of die and then become famous. But I was a hobby, drawing and painting. But then I found this wonderful world of cosmetic tattooing from a colleague at work who'd had her eyebrows done. And that was when I was first introduced to cosmetic tattooing. And then by looking for courses and looking online for what I could possibly achieve down that road, I found the medical tattooing, or paramedical tattooing as the correct terminology is.
Yeah.
And it was only after that then I felt I'd found my place, because not only does it combine artistic skills, it combines my mental health nursing training. Because there's an awful lot of ladies who go through so much trauma, mental health issues, need a lot of support, and I find it's just the perfect combination.
It's interesting, isn't it? Because I think I'm in the same game in the sense that as a physiotherapist, yes, I'm working on scar tissues and shoulders and exercise programs, but I think we become amateur psychologists in a way to our patients, because we're getting, we're spending a lot of time with these ladies, and they are often talking to us probably in the aftermath process.
That's it.
Where they've actually had a bit of time to digest what's happened to them. So we become quite a point of discussion, and that's a healthy thing. I think, you like me probably enjoys that role.
And it's lovely to develop that relationship as well, because, the tattooing in a way, it's not just a one-off treatment. They're going to come back maybe yearly, 2 yearly, just to have it retweaked, recoloured. And it's finding that relationship and that confidence and that trust within a person that they feel comfortable with. And that was the reason, one of the big draws as to why, when I did the research into just what was available out there for ladies, where could they go to have this done, there was very limited places. It's either in a tattoo parlour, which is mainly male dominated or orientated to males, and it's not somewhere where you want to get your kiss off basically and show the world your scars, or it's somewhere where it's a little bit more younger, the younger generation, where it's all body beautiful, and ladies would probably feel quite intimidated surrounded by in a beauty parlour or studio or something. So I then thought it was my goal then to have my studio built, and it was aimed especially where ladies would feel comfortable and clinically safe, but comfortable and in a more nurturing environment. Because
I've seen photos, I haven't been there myself, but I have seen photos of the way you've set your studio up in a beautiful little town on the Sunshine Coast called Yamundi, which is very picturesque, and I can see how much care and effort you've taken to set that place up to be nurturing and comfortable. So I think you've done a great job there. It's just my happy space. Everybody who comes to see me, they all comment on just how comfortable and warm and just that's another interesting point actually, because I have heard a lot of my patients express that walking back into venues, shall we say, that are more medically inclined, even if it's a long time after they've had procedures done there, if it's the place they've been to have their chemotherapy or whatnot, it can trigger their emotions. It can be very triggering, and there's always a box of tissues on hand, and there's always tears, because once the first initial work is done and they stand in front of the mirror for the first time and seen the visual effect. It's quite profound, after such a journey, it can be quite, it can be very triggering, and it can also be very emotional. But possibly, do you also find a fair amount of closure for the patient as well, to come full circle from losing their breast to and that's where a lot of the tears come from. It's a release of thank God that's over. Behind me to a degree. I think, in saying that, I always say that with a touch of caution, because I think the breast cancer journey is not necessarily completely over for anyone who's gone through breast cancer. And I think certainly breast cancer survivors appreciate that. Yes, we can put it behind us to a large degree, but there is always, it does lurk, I think, unfortunately, in the back of survivors' minds. And I think as health professionals, we need to acknowledge that, and rather than pretend that doesn't happen, it's like, that does happen. So, the role of the nipple tattooist is as important to a degree as the surgeon, obviously. Maybe not life-threatening, but certainly, like, every player, and there are so many players in the team.
It's a massive team.
Each person has to do their role so well. So, So walk us through from sort of woe to go, if you can, Deb. What happens with regards to someone coming in to see you to get a nipple tattoo done if they, say, haven't got a nipple reconstruction happening? What's the process of just a 3D nipple tattoo?
Okay, so my ladies are normally referred to me by one of my breast surgeons who, after they've finished their work, they've given them the sign off. Yes, you can go and do this now. In some cases, it's after having a nipple reconstruction, but in some cases that's not an option, or it's not a choice. For me, it's easier to repigmentate the whole thing.
Right. Yeah.
So for me, for a lady who hasn't had a reconstructed nipple, it's easier for me to do my work, because then I'm not working with tissue that just might be very sensitive or fragile, or just a little bit off centre, because no matter how skilled the surgeons are, they're normally working on someone who's lying flat.
Yes.
So once they stand up and once the work has settled, there's always going to be a variance. Like we all are. People have not gone through this. None of us are even and straight and symmetrical. No. But trying then to marry two nipples, which just might be a little bit off, is always a bit more of a task.
Right.
It's not unachievable. It's a bit more of a task. Yes. So in either case, whether or not they've had a nipple reconstruction or not, it's the same process.
Sure. Right.
So I normally do it over 2 appointments. The first appointment, but if the lady agrees, after she's come and had a chat with me, and I'll go through everything that this is what I want to do. The first process is to do the measurements and the placements. So it's normally done standing in front of a mirror, and we get the lady to stand, or the gent, it works both ways, to stand just really natural, shoulders back, just relaxed, and that way I can get the placement, the height, where we're going to do this. In some cases there's a deformity in the breast shape. It's not always going to be as it was dome shape. Sure. There may be a little dent.
Yes.
So the nipple and the areola just might need to be over a bit.
Yeah. It's to compensate for that. Yeah,
and it's all to do with how the eye's looking at it.
Yes.
So it takes a little bit of skill just to get that right. And what I do, I draw it on first and we paint it on.
Yeah.
Using the colours I'm going to be using, but just colouring them on the skin first.
Yeah,
so
sure.
We can stand in all directions and just judge the shape.
Which must be a lovely relief for your patients, because they can really see what not necessarily the end result's going to be, but close enough to
Absolutely.
it that they go, okay, I'm comfortable with that before I take that hurdle.
Because there's ladies who not just have a unilateral, bilateral. Bilateral is obviously when you've got the 2 sides, and that is probably easiest because we're doing them both together. We're using the same colours on both sides. A lady who comes would have only had a unilateral mastectomy. You've then got to match the colour and the shape to the other one, which is more of a challenge.
Yes.
Because again, not all areola and nipples are circles. They're all kinds of shapes, and that shape changes depending on temperature. Yeah. So we can be measuring one, and then you've looked away again, or the temperatures or the air cons come on, and it's changed again. Yeah, right. So it's getting sort of a middle ground on just where we're going. So the first appointment is that it's measuring, it's putting the preliminary work in. I use my little tattoo machine, and I do a technique that uses tiny thousands of little dots. So rather than colouring a whole mass block, I do little dot work, and that creates shadow and shade and definition. So
quite different to a standard tattoo, is what you mean? Yeah, sure.
Yeah. So it's not hard lines, it's very soft, and in effect, when that starts to settle down, the colours merge a little bit, and it all blends softly. So it's not a hard cartoony type effect.
Now, of course, if people are, thinking about breast reconstruction and nipple tattooing, one of the questions that must pop up is it painful, or is this an area of their body that is actually quite numb because of the surgery?
It's so individual.
Right.
Everybody's surgery is different. Skin has been moved around, nerve endings have been chopped and changed, and it all depends on the person's perception. Again, it's going back to surgery. It's triggering memories, it's triggering pain responses. And if somebody comes to me and they're so anxious because they don't want to feel any kind of pain, they're more likely to, because it's in their mind already. So the tiniest little feeling sensation is going to, it's going to multiply, and it's going to make
That's a really
worse. Interesting
comment, actually, because similar in the physio spectrum, pain is so contextual. I think for the layperson, without sounding derogatory here, people who have no training on how pain works, pain is quite a complex thing.
It is.
And it is so much more driven, isn't it, by what's happening from a mental perspective.
And anxiety drives pain as well, so it's a bit of a vicious circle.
Hence where we do ultimately, I think, become a lot more of a our main role is to reassure, support, educate. The more we are able to do that with our patients, the dampening of the trauma, so that's really fascinating, because you go, I'll tattoo nipples on. It's like, well, I do a hell of a lot more than that, It's the amateur psychologist thing kicking back in, isn't it?
It is. I've had ladies who've come and that have been really anxious. Have ladies who've come and have been so carefree. Just do whatever
Get in there.
Just do it. It's all good. But there's one particular lady who was really angry. She came to me angry. I never met her, but she was angry. So I spent a good hour de-angering her, getting her to tell me her story, and her anger was justified, her fear was justified, and once we've gone through that and talked that through, and you could see the whole body language changing, you could see her attitude changing, and absolutely lovely. And we had a really good result. Which is awesome. Going back to your pain thing, there is always a chance you're going to feel a little bit of a pain, not pain, it depends on what your pain is.
Thresholds up, sure.
Anyone who's had a body tattoo will know it's not the most pleasant thing in the world, but it's not...
it can be made tolerable.
It can. I have anaesthetic, topical anaesthetic gels and lotions which I get on prescription from my doctor breast surgeons who very kindly provide me with that. And so if there is a need to use it, it's there to be used.
Fantastic.
And I'll always say to my lady, if you're at all feeling this or feel uncomfortable, just say, I'm not feeling this myself. I don't know what you're feeling. You have to tell me. Don't just sit there and think, oh my God.
Yes, I think my favourite line in a physio session is, geez, that feels tight. And the patient's like, yes, I'm on the receiving end. So,
it's all about communication.
Oh, isn't it?
If you're feeling uncomfortable, you want me to stop for a second, just say. And it's easy. We can resolve all of that.
Yeah, absolutely. Now, what's the aftercare process like after a nipple tattoo?
Okay, so aftercare, of course, it's as if you had scratched your skin. I'm causing a bit of a wound. I'm using little needles, and they're going to be scratching the surface to implant the pigment into the skin. So downtime will be a few days of giving it some air time, letting the air out. It's just like you would treat a wound. If you'd scratch your knee, scratch your elbow, you need to let it heal. And the best way to do that is to dry heal. Try and avoid any creams or anything that might introduce any kind of bacteria into there. We've all got creams and potions and lotions in our cupboards, but we don't know how long they've been there and what's been growing in them. So it's best not to use anything. Just keep it dry, clean, until the skin is healed. And then after that, do what you will with it.
Fantastic.
So no swimming, I say no putting any creams on it. If there's any sign of any infection, obviously then it's a case of getting antibiotics, which should be in the way of a cream, or it could be an antibiotic oral tablet. But I've not had an infection, so I pride myself on my nursing skills. As a nurse, we have everything's done in a sterile kind of field. So the whole procedure is sterile as best as I can.
And this might be a controversial question, but I think I'll ask it. From the perspective of the patient, do you find that when women have just a 3D nipple tattoo versus a nipple reconstruction with a tattoo on top, is there difference in patient satisfaction at all?
No, because the way I do my tattooing is 3D. So I will make that look as damn near natural as I can, so it actually looks like it's protruding, the nipple is protruding, there is an element of protrusion from the skin.
And I probably come at that question from the angle of like, if a female knew that she could just get a tattoo as opposed to have another surgery where there's you know, obviously more anaesthetic and it's more time and all that sort of thing, so not to downgrade just the 3D tattoo, but more from the angle of like, oh well, if I didn't have to have another surgery, am I going to get a good result?
Absolutely.
Yes.
The choice is there. You know, the surgeon will guide that person as to which way to go. The skin might not be viable, there might be too much scar tissue. It depends on where they're going to take the skin from to create that nipple. And if that nipple is then going to be viable, you know, not all nipple reconstructions surgically are successful, so there's always a dropout rate. The doctor has to get a good blood flow to that piece of skin that they're actually making into a nipple. So there is always a risk. There's always risk involved.
So what Debbie's talking about there, guys, is this idea that any tissue that gets moved to a new place essentially has to have its own blood supply. So if anyone out there's had a DIAP flap breast reconstruction, you'll probably already be aware that the fatty tissue taken from the abdomen, when they place the breast tissue in the chest, it has to uptake its new blood supply, and this is the biggest risk factor, isn't it, really, with that operation. And obviously what you're talking about here is it's the same with the nipple. So we really have to be conscious of, I suppose, well, not we, but the surgeons have to be conscious of the candidates they're picking for this type of surgery.
And of course, infection is always a big risk. Part of the risk that you have to weigh up. You've gone through so much to get to where you are. You can't, you know, do you really want to risk having
another infection? And I suppose that's where my question comes from, is this idea of like the point of a woman getting to breast reconstruction, but then having to go through the reconstruction itself plus the nipple reconstruction. There's a lot of decisions, obviously, that have to be made, which is one of the reasons I thought I must get you on to do this video, because you're talking about this, I suppose, the end game to active treatment, really, isn't it? Because you're probably the final rung, you know,
the cherry on the
cake. Indeed, in this very long line of people that a patient has to see. And just the outcomes of 3D nipple tattooing by itself versus nipple reconstruction plus tattooing, that would be another big decision.
It is. It's a conversation to be had with the surgeon, and what would be the success rate? How would it look? You know, what could be achieved? And it all depends on, you know. And then if you are a candidate for it, it's, do you want it? Do you want to look down and actually see a protrusion of the nipple, or are you happy with the visual effect from a distance? That is really,
and that's all. It's so personal, isn't it? And at the end of the day, I really get quite not frustrated, but cranky, for want of a better word, when an outsider will judge a breast cancer patient. I'm sure you're the same. And they'll say, oh, why would they do that? That's just ridiculous. It's like, oh my God, guys, like, this is this person's body, this person's choice. Like, they have been through such a unique individual experience. So do not judge the person who chooses to A, be flat and fabulous, or B, you know, whatever they choose.
Because it's not only them in that world. They may have a partner, a husband, and it's and again, it comes down to the sexual health as well. It's you know, part of sex is the visual appearance.
Of course.
And if somebody has lost what they deem to be a lot of their femininity, because breast cancer, let's face it, it strips a woman of most things, including their hair, their eyebrows, their everything.
Absolutely.
To be able to restore that and confidence and self-esteem in a sexual way as well for them and the partners or subsequent partners.
And I think that's a great point. You know, it's in a lot of cases it's not just that person. It could be the partner involved and how they would be impacted if that wasn't necessarily done. And again, I think that to the outsider that could seem quite rough, because someone might turn around and go, well, that should be her choice. It's like, well, you know, there's a lot of psychological elements to this.
There is, and we're dealing with an illness where there's a high risk or high percentage of relationships that fall apart because of this, or the other partner can't cope with this. And that's one of the saddest parts about it. You know, some of the stories I've had is from the husbands or partners just couldn't cope with the visual impact and the loss of
Yes.
And then the poor lady's dealt a double blow then.
Yeah,
especially
absolutely.
when they then see that person with another person, and it's horrific.
Yes, absolutely.
I've always tried and put myself in that position, and it would be
totally devastating. Yeah,
absolutely.
Sure. Which again comes back to, I think, the fact of there are so many players in the team, and we need to look after the physical side of the patient, but very much the mental, emotional sides of the patient, which is where people like you and myself, we need to be in fantastic communication with the other members of the team. Obviously, you'd be talking to the plastic surgeons and the breast surgeons often, but certainly I'm, talking to the mental health professionals as much as you are probably as well. So that's why we're starting to do these videos, guys, with, our counsellors, our women's health physiotherapists, who obviously play another big role in sexual health after breast cancer. So so it's a very complex place to be in, isn't it?
It is, and I always invite the partner as well. And there's many couples I've had, who have come together and they've chosen the colours together, they've chosen the shape and size together.
Wonderful.
And in a lot of cases, it's the new partner who's helping this lady through this.
Yeah.
Because a breast reconstruction and the nipple tattooing doesn't happen immediately. It could be 5 years down the line.
Yeah.
It's not something that happens straight away as a matter of course.
Yes.
It's a process. It's the emotional drive as well. It's everything. Life changes.
Yes.
Relationships change, situations change. Whereas a lady in the first instance would say, no, I'm just happy to be alive. 5 years later on, they've got a new relationship or things have moved on for them. They actually, no, I want to revisit that now, and I feel more confident now, and I want to do this.
I see that happen often. Yeah, there you can see the patient allow the dust to settle, which I think is a very healthy thing for a lot of people. It's always a good thing to do. And again, individual choice. I've got plenty of patients who've had an immediate reconstruction on the same day they've had a double mastectomy, and they're very happy with that choice. The other question I had for Debbie today was that is there a delay in when you can get the nipple tattooing started after a nipple reconstruction?
Again, that would be determined by the doctor. I can only do it once I've had that phone call or chat with the doctor to say, yes, they're suitable to go now.
Yeah.
Each reconstruction is completely unique and individual, and there may then be another further diagnosis of more breast work needing to be done internally.
You're talking about fat grafting, and
I'm talking, and even if cancer reappears, its ugly head. So until we've got that 100%, we're good to go. With as far as the tattooing is concerned, each person is so unique and individual.
Sure.
So there's not. I can't really say there is a specified time line on it. Yeah. It's all to do with the doctor. Yeah. If he's happy with the way things are going and the skin's good and its integrity is intact, then we can do it.
Yeah.
Or if let's say the lady has a breast that she wants more work done on it in the way of reconstruction, there might be a bit of a fold that she's thinking that it could be helped with a bit more of a lift. I had this happened recently actually. The lady came for bilateral, but she wasn't happy with the way one was sitting, and it was noticeably higher and or lower, and she needed to have more fat put in. So on that day we just did one side, the side she was happy with. We just did one side, and once this side's been corrected in a way of more fat put in, then we'll be able to match it up. Because if I'd done it that day, knowing that she was going to have future surgery, so she was more than happy just to have one side done.
Yeah. And so if you're not following here, guys, what Debbie and I are talking about is that following breast reconstruction, sometimes the major surgery will be done, but then in the aftermath of that surgery, as Debbie was mentioning earlier in the video, where the dust is settling and the body, shape is coming back into place, they can correct contours or lack of contours by taking more fatty tissue out of another source and essentially putting it into the place where they want to fill a space or whatnot. So, and I find I think it's just fantastic that we've got plastic surgeons now so much more involved.
Absolutely amazing.
I actually do feel sorry for the breast surgeons of past days where they were essentially responsible for the breast reconstruction, when ultimately they've trained as an oncology surgeon. They're not plastic surgeons. So the plastic surgeons have obviously got aesthetics at the absolute forefront. So there's a lot of care paid to the final product.
Absolutely. And this is why I just love doing what I'm doing, because it lets me use my skills as a nurse, an artist, to create something together with this person, it means so much to them. It's just such a rewarding job.
Yeah, that's so good to hear. So with the tattooing, Deb, are you finding women can access nipple tattooing after breast reconstruction from a financial aspect?
That's the saddest thing at the minute, because Medicare aren't recognising it as an essential medical procedure. So unfortunately not. I'm really sort of proactive in trying to let this become part of Medicare and get it recognised as a huge essential part of finishing touches regarding reconstruction, and trying to have the discussion with surgeons to push this too. If we can get it to be an item number, recognised as an item number through the breast surgeons, they can add it onto their cost for Medicare or the health funds, and then it's paid for. But at the minute, no. So what I do, I did do this service for free initially, just when I first started doing it, mainly as a way of getting my photographs together and presenting them in photo books to the doctors. I was doing it for free, but obviously I can't continue to do that. But what I do is charge a one-off fee for my ladies, and then after that, any retouch, any touch at work in the future, however long it is, I'll do that for free. So that is the only thing I can do, which feels as good as I can do at the minute. But we really need to push this.
It's interesting, isn't it? Because I think, again, like, that becomes such a barrier to a woman being able to move forward psychologically, psychosocially, however you want to put it. And we know breast cancer as a whole is an expensive game.
Absolutely.
Even if you go through the public system, I think there's still a hell of a lot of costs involved.
There is, and you know, people can't go to work. They decide maybe not. They can't go back to work. They've lost their confidence. So the finance is always an issue for a lot of people. And therefore we really need to push the need to get the nipple tattooing as part of breast reconstruction moved on and be accessible through Medicare.
Well, the good news is we are having a breast cancer survivors think tank in a couple of weeks' time, so that will definitely come up as a topic. And following the breast cancer think tank, we will be taking the results of that meeting back to industry leaders and any breast cancer organisations that would like to pay attention. I would really love to put some of the stories from the survivors themselves into action and see if we can't render some of these issues in
that
the system.
would be great.
Yeah, cool. All right, well, thank you very much, Debbie.
Welcome.